Namaskar, I'm Dr. Priyanka Sharma, plastic surgeon with HexaHealth, and today we are going to bust a few myths on ingrowing toenails. Now, normally the nails grow above the surface and they grow out of the nail folds. But if your nail starts to grow inwards below the region of the skin and inside the region of the nail fold, then in those cases it is known as an ingrowing toenail. Now, if it causes recurrent pain or there is redness in the region, causes discomfort, or it causes swelling, then those are the signs and symptoms that you may have an ingrowing toenail. Now, these are, as the name suggests, in the region of the feet, that is the toenails, and they do not cause any discomfort or they do not recur in the region of the hands. Now, most commonly they happen due to closed footwear and due to tight footwear. So, in the region of the toe, when there is constant pressure and the nail, instead of growing outwards, if it starts to curl inwards in the region of the skin, this ingrowing toenail can happen. Especially in cases of people who are also diabetic, they are prone to getting ingrowing toenails. The answer is yes. Because of the constant pressure over the region of the toenail, it grows inwards and it causes a lot of discomfort. Furthermore, it tends to accumulate a lot of infection in the region and it becomes red and swollen. So definitely, if you are experiencing these symptoms, you have an ingrowing toenail and you must consult your doctor for the same. Now, having temporary relief in the form of topical antibiotic creams and having oral medications such as painkillers, antibiotics, and avoiding tight footwear for a period of time can give you a temporary relief from this. But because they are known to recur, as once the nail starts to grow inward, it continues to grow inward. Therefore, for a permanent solution for it, you must consult your doctor and the removal of that part of the toenail is necessary. Now, most commonly, as they happen due to closed tight footwear, yes, they can be prevented. But if you have a tendency for the nail to grow inwards, if you're diabetic, or if you sweat in the region a lot as well, then you have a tendency for ingrowing toenails, and despite your best efforts, it might be difficult to prevent this. Now, once a toenail starts to curl inwards and grow inside the nail fold, usually that is the normal format that it would follow. Therefore, until and unless you get that part of the nail fold and the toenail removed, it is known to reoccur and it would happen again and again over a period of time. The answer is absolutely not. This is further risk factor for you because while trying to cut an ingrowing toenail, you may damage the nail fold in the region and you may cause a serious source of infection. Also, it would be very painful for you to try and cut that part of the toenail on your own. Now, this is not as simple as just clipping nails that we do on a regular basis because herein it's the growth part, the growth plate of the nail which has started to grow inwards. Therefore, for a proper treatment, it has to be surgically removed, which is done mainly under local anesthesia, and therefore you should consult your surgeon or your podiatrist for the same. If you have enjoyed watching these videos, you have helped gain information and knowledge regarding any of your queries, then please like and subscribe to our channel and share it with all your friends.